Hello, I would like to present the work titled Evaluation of Diagnosis Strategies and the Inclusion of Placental Malaria as Potential Etiology of Low Birth Weight in Newborns from an Endemic Area for Malaria in Colombia. Placental malaria is a special condition which is present in the pregnant woman who lived in an endemic areas for malaria and consists in the sequestration of infected red blood cells in the intervillous space. It happens because of, in that tissue, there are special molecules which are complex carbohydrates called chondroitin sulfate A and hyaluronic acid, and they display a special role as receptors for infected red blood cells. Placental malaria has been observed in malaria by Plasmodium falciparum and also in malaria by Plasmodium vivax. So it's present not only in high low transmission areas but also in low transmission areas. It brings some problems as miscarriage, intrauterine growth restriction, and low birth weight. Also, a big problem with this condition is the late diagnosis, which is only possible after delivery. The problem is placental malaria has been reported in endemic areas for malaria in Colombia, and does not exist a protocol for its diagnosis. According with the management of low birth weight, it seems that it's never associated with placental malaria as potential etiology. The main goal of our study is to determine if placental malaria is considered as etiology of low birth weight for gestational age in fetuses born in an endemic area for malaria, and what are the diagnosis methods used in order to confirm this placental infection. In order to achieve this goal, a retrospective, observational, descriptive study will be run in medical stories from pregnant women who attendance to the antenatal control and delivery in a third low-level hospital in endemic area for malaria in Colombia. After that, in order to obtain and analyze data, a sample random sampling will be applied. Preliminary results shows that, or better suggest that in Colombia, low birth weight is present in endemic areas for malaria, and there is not even knowledge of placental malaria in the gynecobstetric services. There is no protocol for diagnosis of placental malaria, and low birth weight is not considered as a consequence of placental malaria. Of course, these preliminary results do not allow conclusions to be done. However, after a review of the literature, organizations of World Health Organization, PAHO, and NIH in Colombia, it's observed that they are applying surveillance, or better, they are focused on surveillance and management only on malaria during pregnancy, which is a different condition than placental malaria. It could explain why gynecobstetric services doesn't have protocol in order to make diagnosis, surveillance, and management of placental malaria. New strategies for early diagnosis of placental malaria are needed, and a protocol of follow-up and management of newborns with low birth weight in endemic areas for malaria in Colombia is needed as well. Thank you.